ready to begin.
All right.
Dr. Escott, if you would begin.
I'm Dr. Mark Escott. I'm the Interim Health Authority for the City of Austin and Travis County. It's important for us to understand that right now we're at a critical stage in this evolving pandemic as it strikes the City of Austin and Travis County. We're at that stage because right now we have evidence of community spread, and that means that our success in battling and defending this community against this virus depends on every single person in the community. There are three important factors that we have to keep in mind. Number one, this disease is not an equal opportunity killer. For young people, we expect the vast majority of them will have a mild illness. The big risk is sharing it with older people or those who are at risk for more serious complications. That's why it's critical that we heed the warnings and we check ourselves. That's number two. Before we go out, before we go shopping, before we go to the pharmacy, before we go to work, it's critical that we all check ourselves, check our symptoms. Do we have a cough? Do we have a fever? If we have either one of those things, we must stay home. And finally, if we're sick, it's not appropriate for this to rush to the emergency room or to an urgent care. We're asking that we reserve those resources for other things that are happening in the community. For this, we don't have specific treatment. Therefore, our advice is call your doctor, if you don't have a regular doctor, to use one of the telehealth resources on our austintexas.gov/COVID-19 site to access telehealth and get advice from a medical professional.
Dr. Escott, our first question from Community Impact newspaper is, now that the community spread is confirmed, as you just said, are there plans in place to alert members of the public who may have been in contact with someone who has tested positive, and how would that work?
So we are still doing contact tracing on those initial cases that we have. When we can identify individuals who've been exposed, then we share that information. But earlier this week, when we announced that we were moving to phase 5 because we had evidence that we could have community spread at that stage, that was a warning to the community that if they go out into public, if they're amongst other people, there is some risk of exposure and spread. That's why we want people to be very careful about going out in public if they don't have to.
Our second question, what about our current situation would need to change for you to recommend to Mayor Adler and Judge Escott that a shelter-in-place order is necessary? We've seen that in some areas of the country. California, for example, has told its residents to stay home for everything except essential travel. What would have to happen in our community for us to get to that point?
Right now we're working very closely with our healthcare systems, with the Dell Medical School, looking at two things. Number one is modeling, and the other is our hospital capacity. And if we see any stress on our healthcare capacity to manage illness, then we will make the decision at that stage.
Could you provide an update on testing, our capacity for testing? I think you provided an update 2 days ago, but any updates there on testing in the community?
We are expecting additional testing capacity to arrive here soon, and we're hopeful that as early as Saturday we can launch community testing sites. Now I want to be very clear, this does not mean we have enough capacity to test everybody who wants to get tested at this stage. We still have to prioritize those who are at higher risk, those who are hospitalized, our healthcare workers, and our first responders to ensure that they have access because it's important for public health and for our infrastructure.
And I should have mentioned that last question came from KView. Our second question from KView, can you explain what is happening with regard to contact tracing as you sort of outlined just now, but a few more details. Could you tell the public if any of these patients have been in public spaces?
Some of them have been in public spaces, again, which is why we gave the advisory earlier this week that there were a large number of potential exposures. Our team, along with partners from the Dell Medical School, are working hard to identify those individuals and contact them to notify them. As the number of cases grow, it's going to be relatively impossible to notify every single person, which is why we've given the community warning that there could be exposure going on.
The next question from the Austin Chronicle. Are any area hospitals experiencing any capacity issues at this point or shortage in supplies?
In discussions with our healthcare partners, there's no stress on the system right now. This is something that we're monitoring on an hourly basis to ensure that we have that situational awareness so that if we do start to see stress, we can make different decisions.
Next, a question from KXAN. You mentioned last night in the update to the number of cases here that there was evidence of community spread in Travis County. But the question is to what extent you're investigating. How many cases do you suspect are community spread, and what have you learned since that update last night?
Our teams are still working on that investigation process, so it's a bit difficult for me to say right now how many are community related. We are investigating 5 clusters, 5 groups that have related cases. And as soon as we have further information on that we can share, we certainly will.
And our second question from KXAN, have any children or infants tested positive locally?
I don't have those numbers. We're working on creating a community dashboard so we can provide some additional statistics and information for the community and for our healthcare stakeholders so that they can all have awareness of what's going on.
Moving on to a question from CBS Austin. What can you tell us about community spread? Actually, we've been through that one, and you've released some information there, so let's move on to their second question here. So despite the closures, we're seeing people gather at places like playgrounds, parks, and house parties in large groups. Is there any action you have considered, and is there anything you can do about that in your role and in the city and the county's role?
Well, we've asked our law enforcement partners, our code enforcement, our fire marshals, to pay close attention to these gatherings. But ultimately, we're asking the community, we're asking them to understand the risk, to understand the goal. Our goal is so that we don't have a rapid increase in cases which are going to exceed our healthcare capacity. If we do, that could lead to unnecessary deaths. And so we all have to be strong together so that we can achieve this goal together of flattening that curve.
A question from the Austin American-Statesman. Could you explain why the number of cases here in Travis County is rising so dramatically, and what should people expect to see in coming days with the number of positive tests? Could you sort of speak to how you would expect to see that continue to rise in the future?
So I think right now we're in a catch-up phase of increasing our testing. As we increase testing, our detection is going to increase. I would expect over the next week or so we're going to continue to see significant increases. What we're really focusing on right now is what's it going to look like in 2 or 3 weeks. We've implemented mitigation strategies much earlier than other places across the United States. Rather than waiting on hard evidence that we had community spread, we made the decision to act as soon as there was indication in the community that it could be happening. And I think those will serve us well over the next weeks and months to really help us flatten that curve.
And our second question from the Austin American-Statesman. Personnel with AFD, EMS, and APD who have a fever are sometimes being told that they don't qualify for a coronavirus test. That's according to union representatives. Why is that, and is there anything being done to change that?
I'm not aware of any specific cases like this. I will say that we have dedicated first responder testing centers because they are high priority. And certainly anybody who has, who's a first responder that has symptoms consistent with COVID-19, we absolutely do want to test them.
And you mentioned the catch-up phase in regard to the number of cases. We know the confirmed cases are at 41 as of yesterday. But as we're in this sort of catch-up phase, could you speak to how much larger that number could be right now, and by how much? That's a question from Fox Austin.
It's a bit hard to gauge at this stage. I'll tell you right now that, and we're still working on getting all the information on all the people who are being tested. It's a little challenging now with private labs online. Of the labs that we've been able to get the denominator on, the positive rate for those tests is about 5 to 10%. So still, 90 to 95% of people who have a flu-like symptoms have something other than COVID-19.
Mm-hmm. Moving on to a question from the Austin Business Journal regarding construction. So construction sites, as of now, are allowed to remain open as long as they have less than 10 people. They're operating by that order from the city and the county in a single space. So has there been any consideration or discussion of closing construction sites completely, similar to what Boston has done?
I think we're asking any business that stays open, if it's construction or a different business, if they're going to stay open, they need to abide by that social distancing. If you can't get 6 feet in between individuals working, then you need to reconsider staying open. Again, we're not going to eliminate the risk of spread. We really need to decrease the risk of spread.
And our second question from the Austin Business Journal, are any businesses being added or removed from the list of exemptions for the ban on community gatherings?
So we're working hard right now, our law department, on providing more specific information, particularly with the addition of the governor's order. We're going to have to revise a little bit, and we should have further information on that later today, I believe.
That's all our questions from the media members in the poll. I have one additional question from us, if you don't mind.
Sure.
So is there anything in the future that could be done specifically for vulnerable populations? You mentioned this is not an equal opportunity disease, and is there anything, rather than a blanket limit on 10 people in a space, anything that the city, the county, and Austin Public Health can do to protect the people who may be most at risk?
So we acted very early to really secure the nursing homes and the hospitals to try to protect them as much as possible. We do have a task force right now working on determining if there are further ways to mitigate the risk of spread and to strengthen our ability to provide support to those nursing homes and assisted living facilities to really do as much as we can to try to protect those populations. Again, it's critical that if you're sick, you stay home. If you're going to go out, to check your symptoms before you go home. Remember that if you're young and healthy, that the risk, your risk of having a complication is very, very low. The bigger risk for the community is if you share that with somebody else. So we're asking young people, stay home when you're sick. Stay home if you have even a cough, because that could be an early indication of disease. And finally, we have to protect our ERs. We have to protect our urgent care and our healthcare infrastructure. If you have mild symptoms, use that telehealth resource. Call your doctor so that we can work together to ensure that we have enough resources for those who need it. I just, in closing, want to say that our community has come together, and we are strong. And it's important that we harness that strength, that togetherness, that community attitude to get through this. And I'll ask folks to really avoid sharing information which is false or that may generate fear, because this breaks down our ability to come together and in this time, in this difficult situation that we're in, we need us all working together. Thank you.
Thank you.